All right, so I'm in chapter 28 of the Fundamentals book, which talks about head and neck assessment. So before we get into details about that, one thing that's going to be really important for you to know and that I want to go over is are the cranial nerves. So in this chapter, I feel like ATI is really disjointed and kind of butchers trying to teach people cranial nerves. So I'm going to try to teach it in a little different way. In the chapter, they talk about like a couple here, a couple there, kind of repeat some information over here. My advice is to learn all 12, memorize the 12 cranial nerves and what they control, and then use that information that you memorize to inform you how you would test for intact cranial nerve function. So I recommend using a mnemonic. There's lots of mnemonics out there for cranial nerves. Some are G-rated, some are like, R-rated. The one that I used is on occasion, our trusty truck acts funny. Very good vehicle, anyhow. So just pick a mnemonic so that the first letter of each of the words in your mnemonic helps to make you remember the name of the cranial nerve. In addition to having a mnemonic for the names of the cranial nerves, I would also use the following mnemonic to memorize which cranial nerve controls sensory function, which one controls motor function, and which one controls both sensory and motor function. So this is the mnemonic that you should remember. Some say marry money, but my brother says big brains matter more. So that's a pretty easy one to remember. So I pick a mnemonic to remember the names and then remember this mnemonic. So the way that this one works is some of the words start with S, some of the words start with M, and some of the words start with B. The ones that start with S, then you know that that cranial nerve is for sensory function. If it starts with M, that's for motor function, and B is for both. So for example, some say money, some starts with S, so cranial nerve number 1 controls sensory. Okay, so pick a mnemonic and let's go through each of the 12 cranial nerves. So if you are following along with cards, I am on card 66 and 67 in the deck, which kind of goes over all 12. So cranial nerve number 1 is olfactory. It controls smell. You probably won't get a question about it because it's too easy. ATI won't ask you a question about smell. Cranial nerve number 2 is the optic nerve, and so this controls vision. So the way you would test for this is you would have the patient, you would use this like Snellen chart to see how their vision is. You would check for both nearsighted vision as well as farsighted vision. Cranial nerve number 3 is oculomotor. This nerve is responsible for most eye movements as well as pupil constriction. So in terms of how to test for this, you would put your finger in front of the patient and do like a big H and have them follow your finger without moving their head. And then in terms of pupil constriction, you would shine a light in their pupil, make sure it constricts, and make sure the other eye constricts as well at the same time. Cranial nerve number 4 is trochlear. It allows the eye to move in, down, and laterally. Cranial nerve number 5 is the trigeminal nerve. So this controls chewing. So this is like a motor, controls motor as well as sensation. So face sensation is also included in the cranial nerve number 5, the trigeminal nerve. So if you wanted to test for function of this nerve, you might have your patient like close their eyes and like touch their face and have them tell you what they feel. And then you could also assess their chewing. Cranial nerve number 6 is the abducens nerve, and this controls or allows the eye to move laterally. Cranial nerve number 7 is the facial nerve. So this controls facial muscles. It also controls taste, specifically the anterior 2/3 of the tongue. And it also controls the salivary glands and lacrimal gland. So if you wanted to test for function of cranial nerve number 7, because it controls facial muscles, you can ask your patient to smile, to frown, to puff their cheeks out. Then you would know that their facial muscles are intact. So cranial nerve number 8 is the vestibular cochlear nerve, and hopefully I'm not butchering that too bad. That controls hearing and balance. Cranial nerve number 9 is glossopharyngeal. That controls the parotid gland and the patient's gag reflex, which is super important because you always want to make sure their gag reflex is intact before you feed them or allow them to drink anything. And it also controls taste, specifically for the posterior 1/3 of the tongue. Then you have cranial nerve number 10, which is the vagus nerve. So this controls the pharyngeal and laryngeal muscles, which are needed for swallowing as well as speech. So this is a super important nerve. It controls voice, gag reflex, in addition to cranial nerve number 9. And then it also helps control thoracic and abdominal viscera. So basically sensory function in those internal organs. And then cranial nerve number 11 is the accessory nerve. That controls the sternocleidomastoid muscle as well as the trapezius muscles, which allows the patient to like shrug their shoulders or like turn their head. So if you want to check for function of that muscle, then you could like push down and ask them to shrug their shoulders so you can test it that way. And then lastly, we have cranial nerve number 12, which is the hypoglossal muscle. This controls tongue movement. So to test this, you would have them stick out their tongue and move it to side like that. Just like that. So those are the 12 cranial nerves. You definitely need to know these. And then if you can remember what they control, then you know how you can test those. You can kind of answer questions about how to test those cranial nerves on your test. So I'm going to stop here, and when we come back, we'll dig into some more information in chapter 28. Thanks.